Move into our preview for the discussion this week, which is really just the same as last week, only I want you to focus on the non-bone parts of joints. Okay, so the example that I gave is looking at the elbow joint. Okay, and I'm looking at, yes?
Can you do like tendons or ligaments or not?
Yeah, you can do tendons, ligaments. I mean, bones are part of it, but I want you to focus on the other parts of the joint that may get structured, which is a lot of tendons and ligaments.
Like a torn labrum because of like impingement?
Sure. Yeah, that'd be great. Torn labrum. You could do a ruptured bursae or anything. But what I picked as an example is a tear that often occurs in pitchers for baseball. In the ulnar collateral ligament, which connects the humerus to the ulna. Okay, and so these ligaments eventually wear out, get inflamed, may get tears in them. And there's a surgery called Tommy John surgery. Have you guys heard of this? Where they will take a part of the tendon from somewhere else in the body and they will replace the old tendon with that other tendon. And then it takes 6 months to a year, I think, to rehabilitate, and then the pitcher is back pitching again. It's kind of pretty amazing surgery. It's becoming more and more popular among major league pitchers. The question about it was whether or not it actually makes pitchers do better or worse. And so there's been some research, a number of studies that have looked at whether or not a pitcher coming back from this surgery is doing better or worse. And anyway, so there's an article here which talks about those studies. And essentially what they found is if they limited their study to just before and just after Tommy John surgery, it looks like they do better after the surgery. Okay? But why would that be the case, other than the surgery, you think? What's that?
They've had lots of months to rest, so their legs are good, their backs are good,
Sure.
their shoulders are fine.
Yeah, so they've been rehabilitating for a year.
Just before their surgery, they had their problems with their elbow, and so just after it's fixed.
Exactly, right? So you also have this year or many years of wear and tear on this ligament. So when they expand it out to all, like many years before and many years after, it does show actually a decline after, or it doesn't show to help them. But that's also compounded by age, right? They're getting older anyway, so it's hard to really say. It's not conclusive whether it helps or hurts them, but it doesn't appear to.
I've heard that when you slow down somebody's fastball, they have to work on their other pitches, so it makes them a more well-rounded pitcher, actually.
Yeah. So it does show that comparing the years before and the year after, their fastball slows down. But they do work on maybe other pitches. So there's a lot of these variables that you can't account for.
With Boston playing last night, one of the pitchers that for Houston had sleep apnea. He was pitching low 90s, and when they found out that he had sleep apnea, he was pitching upper 90s. We got that fixed, so it's really weird how everything goes.
That is interesting. Yeah, get good sleep and throw harder. Okay, so, but anyway, this is just an example. I didn't go into a lot of detail about it, but I did show you one part of the joint, which was important to the throwing function and the rehabilitation phase as well. So basically, you can do the same one you did last week if you want to. Just expand more, talk about the joint rather than the bones, or talk about a different injury, or whatever you want. Okay? Any questions on that? Okay, and the TAs are a couple weeks behind. They'll get all those graded this week, they told me. So, all right, so joints. We're going to have fun on Wednesday. Today we're going to have fun too, but we're going to talk more about the nitty-gritty substance of classifications of joints. But first off, all right, what is a joint? Yeah, thank you. Oh, there's a joint. Define what a joint is. Okay, good. All right, where two bones meet, okay?
Also an articular.
Is that
Is it also an articular surface?
where two bones meet or articulate? Yeah, that's the same synonymous, yes.
Isn't that like the weakest part?
Yeah, it is also the weakest part of your skeleton. Which just makes sense, right? It's not the hard bony parts, it's now what's filling up those spaces at the joints. All right, we've got connective tissue in the form of ligaments and tendons, cartilage, we've got muscles that may overlap certain joints, wrap around them, or just be peripheral to them. You have, blood supply and nerves often running to and around joints. And we have a new structure that we'll talk about today, where we have synovial joints, which has a specific fluid which allows for compression and gives a little extra cushion to those joints. And of course, we have our bones involved as well, right? And how they fit together. And what's in between them helps us to classify what type of joint that it is. Okay, interesting side note. Have you ever heard that, people can tell if weather is changing by something in their joints? Is it real? What do you guys think? Yes. Who says it's true? Who says it's false? Okay, who can feel the weather in their joints? Okay, who can't? All right, well, I don't have the scientific studies in front of me, but when they've looked at the science, it doesn't appear to be true, that people can't really. What evidence do you have? My grandma.
I have trouble, I guess it has more to do with my muscles, but when it gets colder, I know it's getting colder because my back won't move.
Or at least you think you know it's getting colder. Okay, next time I'll show you the scientific evidence on this, whether or not it's true. And again, the scientific evidence does not support that weather affects your joints generally. Right. Well, you're here today. Yes. Yeah, I'll show you on next time. It doesn't appear that weather really affects the pain in your joints. Yeah. I believe. Okay, so what we're going to talk about the different ways to classify, and this is, I know, repeat from the video lecture. But we're going to go through it anyway. Okay, so structurally, there are different things that we mentioned before, right? As what's in a joint, but they aren't in all the joints. So our first structural classification are fibrous. All right. So in the fibrous joints, they lack these other things. All right, we have cartilaginous. And our third structural classification is synovial joints. All right, and so some examples of our fibrous joints then, we've got 3 here. Are sutures, right? So it looks like our sutures, which are found in your skull.
So is fibrous A through C or just A?
A through C, yeah.
Okay.
All right, it looks like it's just interlocking bone, which it is, but there's also fibrous connective tissue in between there as well.
So what's the difference between like a suture and tuberosities?
Tuberosity is just the part of the bone, but isn't a suture is where 2 bones are connected. Right? A tuberosity generally has, some sort of ligament coming off of it, which is attaches to another bone, or it could connect to a muscle or something else. All right, so sutures are, of course, found in the skull. Again, interlocking bones. There are some dense connective tissue in between there as well. All right, the second one is a gomphosis. All right, this is a socket. All right, and these are found in your teeth. Okay, teeth create a socket. What are the 2 bones that your teeth fit into? Mandible, maxilla, good. And then, okay, sure, but they're the same bones. Okay, so the gomphosis socket is attached by a specific ligament called the periodontal ligament. Okay, when we go to the digestive system and next semester, we'll identify the different parts of the tooth and the gum, and then the periodontal ligament is the part in the bottom which sticks it into place. All right, and then the third type is a syndesmosis, okay? So syndesmoses can be found between your radius and ulna and between your tibia and fibula, okay? And they will have, some of them will have these fibrous sheets between the 2 muscles, okay? So between your tibia and fibula and between your radius and ulna, there is this sheet of fibrous connective tissue in between the bones, okay? The one in your arm is a little more flexible, okay, than the one in your leg. And that allows you to rotate your arm, okay? The one between your leg doesn't rotate as much. Your ankle rotates, but your legs don't rotate, okay? All right, so those are your 3 types of fibrous joints. Your 2 types of cartilaginous ones are a symphysis and synchondrosis. All right, syndesmosis, synchondrosis, very similar, okay? But we've seen this before, right? C-H-O-N-D, cond, which refers to cartilage, right? So chondrocytes, chondroblasts, those are making cartilage. We know synchondrosis is cartilaginous. All right, and then a symphysis is, so the best example of this is the pubic symphysis. So between your 2 pubic bones, you have a sandwich of hyaline cartilage on both sides of the bone and then fibrocartilage in between. Hyaline is what it says. And fibrocartilage in between it. And a synchondrosis then is just hyaline cartilage. And the example of that is your epiphyseal plate. Yes.
So would the intervertebral discs be an example of synthesis?
Yes. Yeah, another great example, the intervertebral discs between the centrums of your vertebrae. All right, and then our third structural classification is synovial, which we'll talk about, we'll draw out in a minute. Okay. We'll draw it out right now, actually. Okay. Okay, so in a synovial joint, all of them are going to have these structures. We'll talk about some accessory structures, but all of them will have these. Okay, so first off, we have our two bones. And on the end of each bone is our articular cartilage or our hyaline cartilage. And you have a synovial membrane then which secretes the synovial fluid and then outside that you have dense, irregular connective tissue. And these form the articular capsule. And so inside then is our synovial fluid. Which basically acts as cushion between the bones. So now the bones aren't going to grind on top of each other. They're going to press into this contained fluid. And as pressure, as this bone pushes down and as this bone pushes down, because it's a fully supported, fluid capsule, as it pushes down, the capsule will increase in pressure and push back. So hopefully, as long as not enough pressure is exerted, there's always going to be that layer of fluid to push back. Okay, within the synovial fluid, you also have immune cells, okay, to clean and prevent infection. And you also have little pockets of air. So phagocytic immune cells. Okay, and these manifest themselves when and if you ever pop your knuckles. So, do we have some knuckle poppers here? Go ahead. Pop them all. Do it all right now. I don't know. My brother goes through like every single knuckle on his body and just like, pops them out. Nephi. Yeah. So we have a few accessory synovial joint structures that aren't necessarily found in all synovial joints, but can be found in some of them. These include fatty pads. Okay, little pockets of fat. Why do you think fat would be great to have in your joints? Yeah, so it's also squishy, kind of like fluid. Helps out a little bit in reducing some of that pressure that it may be exerted there. All right, I have also here meniscus. Okay, you got some big meniscus pads found in your knee, which are made of fibrocartilage. Okay, and that the knee joint experiences probably the most pressure, right? So it's going to need a little extra help. But this is also a common injury in sports, a torn meniscus, where essentially, basically a little like kind of flap will be torn and kind of break off. General treatment for it, if it's not too bad, is just to go in and they just cut it off. Okay, they just slice it so there's no longer a little torn piece flapping around in there. Okay, and then we have bursae. Okay, so this is a synovial capsule, but just not in between the bones. It could be, around some tendons packed in between underneath some muscle or somewhere else. And again, just adds kind of like the fatty pads and the synovial capsule itself. Another place for pressure to be relieved. All right, and then lastly, a tendon sheath. Hot dog, yeah. All right, so this is just a bursae wrapped around a tendon. Okay, and again, it just gives the tendon, which is going to be stretched, right? The tendon's going to be stretched and moving constantly, keeps it from damaging the tissues around it. Has a nice little hot dog pillow. Okay, so we'll go over the shoulder joint tomorrow, but you'll be able to see some specific bursae sheaths. It doesn't have a meniscus, but it has all these other things. All right, our functional classifications then are, let's do the easy one first. All right, diarthrotic, which means, freely movable. Okay, so in these joints you have a range of motion which is much greater than the other two. Yeah, your shoulder, your elbow, fingers. Okay. All right, and the two others we've got are synarthrotic and amphiarthrotic. Synarthrotic means, no movement or very little. And amphiarthrotic means some movement. So some flexibility, but not free. So the list is very similar from the structural classification. We don't want our sutures to move. Well, at least I don't, right? I guess I can't speak for you guys. Okay, they're doing a great job keeping the brain where it's supposed to be. And we don't want our teeth to move. Okay, although that would be kind of cool. I did have a dream the other day that my teeth were rotting from the root down, so I had like little bits of teeth like hanging, but nothing connecting them. I don't know. It didn't make sense. SIS? Yeah. All right, and then, so this is where it flips. So rather than syndesmosis, we're going to do synchondrosis here. Okay, so your epiphyseal line, no movement there. That's just for growth. Okay. And so then our amphiarthrotic, some movements are symphyses. Would be plural. Okay, your pubic symphysis allows for some movement during birth. It is the hormones actually make it even more flexible than usual, and to allow for a little more movement for the baby to come through. And then our syndesmosis. Okay, so between your tibia and fibula and between your radius and ulna, you want some movement, but not full range movement. What's that?
DIS or DES?
I think DES, sorry. And then all synovial joints are diarthrotic.
So then just to clarify, synarthrotic goes with sutures, scoliosis, and synchondrosis, and then amphiarthrotic goes with symphysis and syndesmosis.
Got it. Yeah. Yeah. Now this gets, when we went through it, this seems pretty simple, but it gets pretty confusing, like which S word goes with which, right? And so the worksheet, what I have is a number of joints, and I want you to, some of them we've talked about and some of them we haven't. But I just want you to classify them structurally and classify them functionally, just to practice, And as you do this, hopefully you remember what these things mean, so that if I give you a description of a joint on the exam, you could functionally and structurally classify it. Okay? All right, that's it, right? Yeah, that's it.